I can get started soon. Let's put this up so we can see chat a little bit. There we go. There we go. There we go. Now let's wait for everybody to join. Yeah, wait for everybody to join. Hi, Kat. Hi, Herbs. Hi, Desert Camp. Hey, Loomis. Hey, Jim. Hi, TT. Hi, Joe. Hi, Brianna. Hi, Jennifer. Look who I have here. Look how good she looks. Look at those eyes. Look how good those eyes look. Oh, thanks, Desert Cat. Doesn't she look really good? Yeah, I'm really excited to introduce her today. So let me just give a little bit of background for anyone who hasn't been following along. So this is Einstein. She's about to get a new name. She was brought into the ER 8 days ago, I think. And she had some kind of severe brain trauma. Her owners surrendered her. They couldn't afford her care. And they had multiple stories as to what happened to her and how she was injured. So we will never know what the truth is and what she endured before the ER. But regardless, the hospital took fantastic care of her. They all fell in love with her. They all told me how sweet she is. And even the front desk staff was following her story and visiting her every day. She was kind of a little celebrity at the hospital. The hospital ER doctor who originally treated Sawyer when I brought Sawyer into the ER is the one who called me. She remembered, how we had tried to do everything to save Sawyer and thought that we might be able to help this little girl. So I did agree to take responsibility for her and intake her officially to KKP. She was hospitalized for the last 7 days. Her CT scan shows that she has many, many small fractures all in her skull. She also has, I'm not sure on which side, she has a fracture in her jaw. She had some evidence of brain bleeding. So, it all confirmed that she had some kind of really horrific trauma somehow. When she first showed up at the ER, she was pretty disoriented. Her eyes were so swollen that she wasn't able to open them. She was doing head presses. She was doing circling, tight circles. I have not seen the CT scan, no. I haven't seen it. I don't think I'm going to get that one. And they were giving her some IV meds to help reduce the brain swelling. So each day that she was there, she was improving neurologically, slowly, but showing improvement. After the week that she was there, she was able to walk in a straight line. She still does circles sometimes. She still does head press sometimes, but she's able to, and she does walk around her pen pretty often. So the doctors believe that in time, she'll continue to heal. We don't know if she's ever going to be quote unquote normal, neurologically. She might always be maybe a little bit wobbly, or she might end up having some permanent vision impairment. Right now, it's thought that she's either blind or mostly blind. But we're hoping that just, it takes a long time to heal from a brain injury. And if we just give her enough time, that, she'll improve enough to live, a high quality of life. So we were able to bring her home from the hospital yesterday. And she's set up in a little play area in my living room. She's got a bed in there. She's got some little toys, and she has a litter box. So far, she has peed on the pee pad first. She peed on the rug second. And just before this live, she finally peed in the litter box for the first time. So I'm not sure whether she's litter box trained or if that was just a lucky evacuation. But it seems like she might be a little bit confused about where the box is. So time will tell if she uses that box more consistently. I haven't seen a poop yet. One of the biggest concerns and one of the biggest problems that she's having right now is she's not interested in food. And this might be due to a couple of things. It could be that due to the brain bleed and the sort of extra pressure in her brain, she might not be able to smell the food right now. Cats largely count on smell when they eat, and if they cannot smell the food, they will starve themselves. And so that could be a reason. We would hope that maybe, again, with just giving her some more time, that sense of smell will come back. The other thing could be, she does have this jaw fracture, and so, it might just be painful for her to use her mouth. So, or it could be, any number of other things. So, I'm going to show you, basically I'm going to do a feeding on cam here. I'm going to show her, feeding tube, which is what this little nozzle is. I'm going to show how I feed her through that feeding tube. And I'll talk a little bit more about that when I feed her. So I saw a question about her age. She's 3 months old, but she is small for her age. I weighed her last night. She was 2 pounds, 6 ounces. So not quite 2.5 pounds. That's not, for a 3-month-old, that's not terrible. That's not severely malnourished. Especially considering she went 7 days without food. They did have an IV of dextrose, to make sure that her sugars were staying normalized, but she didn't have any real food during that 7 days. But she's not severely small for her age. All right. So I'm going to show you, this takes a while to do. So I'm going to get started with the feeding, and then I'll be able to answer questions while the feeding happens. You'll see sort of why I have time to do that. So to start, she's wearing this super awkward neck brace, and it covers what's called an esophageal tube, which means this goes directly into her esophagus. This is not super gross, so I can show you. You can see right here where it goes right into her skin. And she wears this to make sure that it doesn't come out. Let me get this back on. So once a day, I take this off, check to make sure that that area where, this is Eden's pink blanket. Oh no, this is a purple blanket. Eden's pink blanket is in her pen with her. And check to make sure that it's not infected. And then we put this back on, and this just, make sure that it doesn't pop out. And then I usually just try to make her comfortable. You want to keep her upright. So I just kind of make her comfortable with the blanket. She hasn't been too wiggly so far. All right, so first you flush it with water. So what I've been doing is filling up her liquid diet in one syringe and water in the other syringe. And then I've been putting these into our bottle warmer and just doing it like lukewarm setting. So I'm not touching anything on the end of this. I'm just pushing this right in and screwing it on. And then you're going to first flush this. So you're going to do, in her case, 4 mils of water flush. And you do it pretty slowly. And you want to make sure this is going to clear out all, anything that's in there, any debris, and make sure that it's not clogged. You want to make sure that this water goes in smoothly without too much effort. So I was able to do that, which means it's not clogged. Now, a few times a day, she gets some pain meds and she's on some antibiotics. And so I'm able to mix that directly into this liquid diet. She doesn't have any meds during this feeding, but it's really easy to get her meds, to get her food in here. One thing I always forget, I was about to forget again, is to offer her food. So, of course, our goal, here comes Tate. Tate always tries to help. Our goal is to get her eating on her own. So, I'm going to see if she gets any interested in a churro. Lick your, open up. They did some tests with her in the hospital. She is able to swallow, which is great, but she did not have much of a gag reflex. So that's the reason that we don't syringe feed her, because without a gag reflex, she could easily inhale this and choke. And she could get aspiration pneumonia. So they told me when they put food on her mouth and her nose, she will lick it, but she won't like actively try to eat, which is kind of what I'm seeing right now. One thing that we really want to get her doing is moving her jaw. So the fracture in her jaw, they believe, will heal on its own and does not need surgery, but there is a complication that can happen if she doesn't use her jaw and move it. It will heal with issues, and in that case, it would not heal properly. So we do eventually want to get her, I'm going to try to get her opening and closing her mouth a little bit more. All right, so Operation Solid Food, not working yet. All right, so next up is the food. Because she went 7 days without eating any solid food into her stomach, we are doing a very slow reintroduction. So she gets fed small amounts to begin with. So to start off with, let me get this up. To start off with, she does 11 mils. Per feeding. Okay. And this gets, again, you just push the plunger down to put it through. This gets fed over 10 to 20 minutes. So what I've been doing is just 1 mil per minute. So 12, 16. So I'll push it down 1 mil and then I wait. So this is why you see me in chat while I'm feeding her, because right now I'm just sitting and waiting for the next minute to pass. So now I can hang out with you guys and read questions more. So the first 2 days, she's getting this 11 mils. Then days 3 and 4, 18 mils per feeding. 5 and 6, she gets 27 mils per feeding. So you get the idea. She's going up each day or every 2 days. And then finally at day 10, she gets 52 mils per day, or per feeding, sorry. And so, we're starting at 11, we're eventually going to get up to 52 mils per feeding on a regular basis. She gets fed 4 times a day. So 8 a.m., 12 p.m., 4 p.m., and 8 p.m. Thankfully, I do not need to get up overnight. I don't have to do any late night feedings. I don't need to do any overnight feedings. So I appreciate that. Oh, sorry, Zeno. So from days 1 and 2, she gets 11 mils. Days 3 and 4, she gets 18 mils. 5 and 6, she gets 27 mils. And it goes like that every 2 days. And then by day 10, she's up to 52 mils per feeding. All right. So that's sort of her daily goal. I'm gotta do another mil here. And the feeding tube itself, as long as it doesn't get infected or come out or anything like that, will last for several weeks. So we don't need to worry about her, needing a new tube, hopefully anytime soon, as long as it doesn't pop out or anything. No, so I don't always need to do just 1 mil a minute. It's a total. So I just need to do, like, at the end, 52 mils, but take 10 to 20 minutes to do it. So, yeah, when we get up to that amount, I'll be doing more per push. Yeah, so it'll always be 10 to 20 minutes per feeding. Yeah. There's not a cover on the end. There's basically like a little stopper and a place where you screw in the syringe, but there's no like, probably because it doesn't go into her bloodstream. It's just a feeding device. Okay, you ready for her new name? All right, so she came with the name Einstein. I'm pretty sure that was the name that her owners gave her. And I just haven't felt a real connection to that name. And I just thought she needed a much cuter name, a sweeter name, something that just rolls off the tongue a little better. So, I chose the name Zoe. 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 It means life. I saw several of you guess it after my hints this morning. So that's her new name, Zoe, meaning life. And that is exactly what she has. Oh, I'm glad you guys like it. I know, I need to wipe her mouth. I was picking her boogers this morning. She had some like good size eye and nose boogers. She tolerates me picking at her. She usually does this. She usually sleeps through feedings. I think she's just really comfy in the blanket. She usually has her eyes closed as I feed her. So this is nice. She's not really wiggly. So it's pretty chill time, feeding time with her. This is definitely not like when I feed tube neonatal kittens and have to put it down through their mouth. They fight me. This is nothing like that. Wow, Shelly. That is a pretty big coincidence. Two big similarities. Oh, here's Mac. Shelly said that her cat's name is Zoe and arrived with a jaw fracture. She does sleep a lot, but she also walks around a lot. She does like a perimeter check of her pen quite a few times an hour. She'll basically walk around the whole outside of the pen. She will walk like through the litter box and then around it. It seems like she kind of leans against the plastic panels a little bit to keep her balance a little bit. And then she'll lay down, take a nap. She'll get up again a little later and do her perimeter checks. So she's pretty good about walking. She can walk a straight line. You can see, she's just a little bit maybe weak or a little bit off balance. But I mean, honestly, considering her injuries, I'm impressed with how well she can walk. She has not made any noise for me. I haven't heard her meow. I haven't heard her purr. I haven't heard any noise from her at all. I don't know if she'll ever fully recover. It's very possible that she'll have some lasting effects, neurological kind of differences, but there's no way to say right now, how much she'll regain and how much she'll heal. Honestly, watching her, it's a little bit like watching like a mild CH cat. That's kind of watching her walk. It's a little bit like that. So she goes back in 2 weeks to the neurologist at the hospital. I'm pretty sure it's 2 weeks. I haven't scheduled that yet, but I need to schedule that. But they want to see her in 2 weeks. Yeah, 2 weeks. Oh, thank you, Mango. This is the first time I've tried food with her. The first 2 times I fed her, I don't know why, but I keep forgetting to offer her food beforehand. And so this is the first food I've tried is this Cheerio, but I have lots of different kitten wet foods, and they said it doesn't matter what she eats. They just want her to get her start eating. So I'm allowed to try pretty much anything, even Frisky's junk food, junk kitten food. So I'll try lots of stuff with her as soon as I get into a better schedule and remember to get food. Thanks, all. Yes, the smellier the better. I might need to go get some KFC, right? That's how we trap smart cats who don't want to get in a trap. KFC. I do have some. I don't think she's going to want to chew anything, though. I think she's going to want, like, puree stuff. She's really, like, so sweet. I was surprised how mobile she is. I was kind of expecting her to be a little bit sleepier, I guess. I thought I expect her to like sleep a lot. She keeps getting her one paw keeps getting stuck in her little collar here. She like gets it up into there, and I've had to tighten it a little bit, but sometimes she still like gets it up in there. So yeah, she's she doesn't just sleep through the day. There's I don't think we have any timeline on the fractures healing, and we're gonna just hope for the best. I think it could be several months before we kind of see what her long-standing effects are going to be. I know. I don't know what the answer is for her paw getting stuck. It's just so large. They don't make these collars for little 2-pound kittens. So, this normally goes on like a full-size adult cat. So it makes her look like she's got a neck brace on. Let's see. Her eyes are not always open. They're closed right now. She closes her eyes. I think she's not vocal just because she's her whole like mood and mentation is pretty dull. She's not interested in playing with toys. She's not purring when I pet her. She's not even like leaning into a pet. When I pet her, there's just no response. So I think just in general, she's just not, she might be dysphoric. Our new word. I think just in general, she's not like, a happy bouncy kitten right now. Yeah, she is on pain meds. Yeah, I think, there's a lot that she is not happy about, I'm sure, right now. I'm taking longer than normal to this. I keep forgetting to squeeze my mill here. Yeah, I don't know. So I don't know if she'll, eventually start making noises or not. I think, part of her scariness or her fear, I guess, is, that her eyes don't respond to stimuli the way that they should if she had true vision. And so I think they said especially her right eye, I think, is like completely unresponsive. And the left eye, I think, might have a little bit of response. So she definitely has either complete blindness or maybe a partial vision, but no, I don't think there's anything wrong with her. Oh, I see. Oxygen would help her head. I have not heard anything about that. Yeah. So this is totally normal, like I said, for her when I'm feeding her. She just settles in, closes her eyes, seems to take a nap. She gets around pretty well with all this apparatus and her big neck brace and things like that. She will, like when she stops walking, she'll sit down and, her neck will be up, her head will be up, she'll kind of just sit there for a while. Like she doesn't collapse, and lay down right away. She does a really good job, in my opinion, like, up and alert. Yeah, the fractures in her head will heal by fusing together. So she'll just have likely maybe some bumps and irregular shape to her head, but yes, the skull fractures will heal. All right, so she's done her food. We got all 11 mils. Last, you need to flush the tube again with water. So I'll just put another 4 mils. Oh, you open your eyes. I moved you around. And this makes sure, you know, we don't want it getting clogged. So that's the main thing. And then that's it. And she's all done. Yeah, so if you missed it, this is Einstein, now named Zoe. Much cuter name, right? Right now, like when I come in and I'll talk to her, she doesn't move her ears to listen to me, and she doesn't move her head like in my direction when I talk to her. So I don't mean that to imply that like she can't hear, but she just doesn't seem to like respond to noises. Of course, I haven't made any, you know, big banging sounds or anything near her, but just like talking to her and stuff, she hasn't really responded to that. There was one other Z name named Zora from the Black Icons. Cool Moo, so you're familiar with it. Yeah, Kenna has done her scratching on the walls that you've seen Kenna do before. She's done that to her. Fizzy spends a lot of time just sitting on the other side of the wall and staring at her pen. And Tate has had the most interaction. Tate, whenever I sit down, Tate has this thing about jumping up on my chest or my shoulders. And so I knew this was going to happen. Sitting down in a chair to feed her, Tate immediately jumped up. And so Tate has like sniffed her and given her face a lick and basically hung around a lot. But, you know, I was watching Zoe to see if she had any reaction to like Tate being, you know, smelling Tate, or, you know, another cat being close by. And it didn't look like she had any real reaction to that. So I'm glad you guys finally got to meet her. I was really excited to see her last night. You know, I think she's, especially her eyes, if you compare, you guys can see her eyes in the beginning of the video. If you missed it, go back and watch, because her eyes are no longer bloodshot. You'll see some of the pictures from the last week that once she did open her eyes, she had like really bloodshot eyes, and they were still really swollen. Now, she opens her eyes, there's no bloodshot, and there's a little bit of that third eyelid, you know, the white part that when cats are sick and stuff, you see more of that white eyelid. I mean, that third eyelid come across their eye. So you can see the white eyelid, when she opens her eye. But the swelling has gone way down. Honestly, if I had just met her today and looked at her, like, I wouldn't have realized that she had a swollen head at all, because it's really, it's not really puffed out at all. No, her eyes do not look like Eden's at all. Yeah, so that's it. I hope I answered most of your questions. Thanks for hanging out this whole time. I'm gonna go put her back. Thanks, Zeno, for CCing, jumping in quick. There is an album already. I have some pictures from when the day she was first brought in and she couldn't open her eyes, all the way until she came home yesterday. So there's a bunch of pictures in her album. You can see a big difference if you look at the pictures of the beginning until yesterday. All right, baby, you want to say bye to everybody? Say bye-bye. You gonna open your eyes and say bye? You still got churu on your nose. Let's wipe your face off. Oops. No more chewer face. There you go. There you go. Say bye, Zoe. Thanks, everyone. It did look like chewer snot. All right, bye, everyone.